Stem cell therapy for liver diseases offers an approach to treating complex conditions like cirrhosis and liver fibrosis. The treatment involves introducing stem cells, sourced ethically or from the patient, into damaged liver tissue where they can regenerate liver cells by differentiating into hepatocytes, reduce inflammation through anti-inflammatory secretions, promote blood vessel growth via trophic factors, modulate immune responses, potentially reducing autoimmunity, decrease collagen buildup, helping to reverse fibrosis. Early research and clinical trials show that stem cell therapy may improve liver function, slow disease progression, and enhance quality of life. It represents a potential breakthrough in regenerative medicine, offering hope beyond conventional treatments.